If it's after hours, we're going to have the on-call team available. Most of the time that's me. It might be one of my other staff physicians, a nurse practitioner, or one of our senior full-time staff nurses here who are also advanced in their training and certification for this field of medicine. You're going to call the number, and if we're not here, you're going to get a voicemail. That voicemail is going to give you then a cell phone number of the lead person on call for the hyperbaric medicine department. You would hang up and call that number. A lot of times that's my cell phone number, and it's not mine, it's a colleague, as I said. If we don't answer right away, leave a message. We endeavor to be very responsive and call back quickly. If you don't get a quick response, call again. If there's no response and you're getting a little nervous, that's when there's more information on the outgoing voicemail as well as in your dive safety document that you can download, which instructs you to then call the hospital operator and say, I've been trying to get in touch with the on-call hyperbaric medicine staff member. I'm not getting a call back. Please pull the on-call phone list or the backup phone list for hyperbaric medicine and tell me who's next on the list. That may be one of the nurses, and just identify, hey, I'm a diver, I don't know if you're on call, but I have been trying to call the person listed, I'm not getting a response. If that nurse is on call, they'll take the lead in trying to call the home line for the doctor on call. We'll get in touch with each other, and if something terrible has happened, if I'm carrying the cell phone and I get in a car wreck and I can't respond to you, then that the second person on the call schedule will then seek to find their complement, another doctor or nurse who can help out, and we'll get you the care you need. And in worst case, if we were all on a trip on a bus and the bus had an accident, we go all the way down to our head administrator, and then we would help you to get to one of our sister facilities in other parts of the state if there were really a worst case. But that's very, very unlikely. We've got a very tight-knit call system there to help you if you're in trouble. Now again, you want to call us first if it's minor. If you go to the emergency room with vague elbow pain after a dive, you're not really going to go to the front of the line. They might not be keyed into what you're talking about. You might kind of get more treatment than you need. You might wait longer, and of course there's more expense involved with that. So for minor problems that you can pick up on the phone and talk to us about, we encourage you to do so. It's going to save you time, it's going to save us time, and we may get directly to the point for a less expensive hospital visit and also more direct care. Again, if it's concerning, if you think it's emergent, then get to the emergency room. All right? So if you have any questions about that, please let me know. If you're seeing me for a dive exam, you can email me. The email's here on the website. And just use my basic email, lanceleedavis@yahoo.com. And if you have any other questions, I'd be happy to answer them. Thank you.